make a difference. So I'll stop.
So I think Sam said it thrice. Man matters at every point of life. So I'm here to prove her right. So here. And I'm the solo male speaker in this. So despite again cervical cancer with many male audience. Okay, so I think I'm very feeling so nervous because these people have given me to change the government policy, and the time given is 7 minutes. Probably we are struggling hard for a whole session to do it, but it took many decades, but I will try to just I will be very fast, very rapid. Please excuse me for that. If you have any question after that, I will be very happy to answer that. So I don't have any financial relationship to disclose. Even IPPS has not paid for anything. I want to disclose that. I've used my own money to come here and speak first time in my life. So, and I have not used ChatGPT. This is my technical declaration. Because nobody should use that I have used. I will be very honest perspective, so please don't take it personally, because for cancer, I'm very sensitive, because I have lost many cancer, family members to cancer, so I'm very blunt in that sense. So coming to eliminate cervical cancer, many people have already said a lot about it. Now you know what is 90, 70, 90, but don't you feel bad? A preventable cancer, which once you're infected, gives you 15 years, 20 years to get diagnosed, that eliminated, or to have an action, we are doing nothing. So there are many success stories now from LMICs in Africa, Southeast Asia, but where is India? India has 1.45 billion population. We tell it with proud, we are the most populous country in the world, and we have, like somebody said, it culturally very sensitive, very different, and we take it very pride in telling people that in every 50 kilometers our language changes, dialect changes, but when it comes to combat the cancer care, it is the most difficult task how to balance those different languages. So coming to why policy matters, because policy will give the fragmented program to have the limited scale. If you have a policy, that is a structure for sustainability, and I think system change. Many people must be frustrated with what government is doing, but that you have a best buy. And while working with different government institutions, Government of India, state governments, I can always say government is very pro to solution intervention if it is not personally motivated. This is the only thing. Everybody comes with a cheerleading attitude. I have done this, so you should do this. And government has a great responsibility to take care of 1.45 billion people, and all the investment should have a wise idea where to invest and why to invest. So mobilizing government action, it is difficult. This is one of the slides we have just written for the Asia Pacific consensus for the lung cancer, which is very true. We are I will come to this is vaccine. Everyone knows that India has given so much to vaccine to the world, because whatever 1 dose, 2 dose, 3 dose, this concept is there's so much of contribution, and it came with lots of controversy, and that controversy 12 years back made us something, learn that we now have a 1 dose concept theory. There are some good things, there are some bad things, but the HPV vaccine is safe and efficacious. But still, most of the people will not be able to answer when to give HPV vaccine, what is bivalent, quadrivalent, monovalent, what is best, when to give, 1, 2 or 3 doses, everybody is confused. I can see in many groups, every day somebody asks what is the dose schedule. No guidance at national level, and it is not part of MP and CD, and I think I just want to correct, our national program for cancer started back in 1975. We just authored one paper and published in Lancet Public Health. We compared 21 Asian countries' national cancer control program. You go and have a read that how India progressed. It progresses not so good, and good thing is that our Honorable Finance Minister gave a focus on that how to just give separate money to start the vaccination. And you must have people from India, one influencer just faked her death to promote the, cervical cancer awareness. I was so irritated, and I can just see what kind of campaign it is, which got life after somebody announced their fake death, and at the same time they announced that they are alive, that is whole death. So I addressed this in a Lancet commentary that cervical cancer advocacy needs more than faking death, because for a cancer specialist, it's nothing like popularity, it's about somebody's life. So coming to the screen, there's so many doubts that the VIA, pap smear and the HPV DNA. Now I can tell if you're doing anything less than HPV DNA, it should be a punishable offense. We should go back and check that VIA, what kind of contribution VIA has made in terms of a decrease in the mortality and the incidence of cervical cancer in India. You just go and read the GBD 2023, I was one of the collaborators, and now you can see that America and China have reduced the mortality and incidence due to cancer. And this is why, because they have adopted the classical evidence-based method. And I think philosophy has too much to play in our day-to-day life, but please go away when it comes to saving somebody's life. It is a cost-effective at this platform. If you want to get a screen for cervical cancer, there is no other test apart from the HPV DNA. How to do it, what is the method, that is a different thing. So coming to the treatment, we focus close to 100% on diagnosis and treatment. This is our USP as a cancer specialist in India. But there are many, many challenges. You can see multidisciplinary treatment. There is not such standard treatment guideline. We follow NCCN, NASCO, ASMO. There's treatment referral. And I think one thing that I can say proudly that our largest insurance scheme has given so much hope to the poor people in the country, and they could able to save many million lives in the country, because they are the big hope with the support system they are providing. At least they can go and find the treatment even in private hospitals if they are covering those schemes. This is one, and I think there is so required changes is there in terms of scheme, but yes, we are going. And one thing, we just recently concluded the one province standard guideline included the cancer care pathway. So we have just completed it, and we are just now going to the. And this is implementation. You know that this is a new science, but probably less known to the people. As ma'am rightly said, we have resources, but we don't know how to do the operation management. And we don't expect the operation efficiency. So probably one thing I'm very, very worried that we need to just move from the philosophy to science. We have evidence. Now there is no dearth of evidence. Nobody can ask, why are you doing it? But where is the action? Which is missing, and probably this is a poor people disease. In action, it is hijacked by the people, something called English-speaking people in India. I just want to do this change. Be sensitive to them. You may get a personal gain out of it, but this is not going to save the life of the people in India. From 100,000 incidents in 2016, we jumped to 127, thousand in 2022. Then 17, we again added 5,000. A preventable cancer is showing an upward trend in terms of incidence and mortality. This is it. Social media has given so much wing. It's many people are just working on social media. I know it looks very lucrative, and you have been approached by the people around the world, but at ground level, nothing is improving. Nothing is improving. Please come and see the ground action. The people who work at ground, they should understand they don't have time to go on social media and say, I have done this. This is also important for awareness, but you should know how to make it balance, okay? So this is one concern, and probably cervical cancer is not just a cause, it's a priority. It should be a priority for any obstetrician. Let me check a fact check. How close we are in terms of 90 and 70%. How many of you are screened for cervical cancer? Just raise your hand. May should not. So when you are in so much of action. So what about the vaccination? How many of you guys have vaccinated, your family has vaccinated their children? I think still we are not close to 90, 70 in a population who is most educated and working day and night for this. Just imagine, we go outside and tell people that do this. Just see where we are. You have to just stand for yourself first. Charity begins from the home. Please, and I think we are very, very passionate to tell others you should do this, but we are unable to convince our own children to go for it, our own family members. So priority for the rich and the poor people matters. If cervical cancer has been happening to the richer people in any country, it would have been eradicated for sure. And I think nobody, 1 minute is too much now. So self-centric approach and cheerleading. I know this is, for me, HPV vaccination is a service. HPV DNA-based screening is a service. We don't have to do cheerleading. If I do 10 biopsy, I don't go to the social media and post that I have done 10 biopsy today. How are you feeling? I don't know. This is a part of, this is my job, and I have to do this. So probably policy action points. Anybody get a time? Communication is the one thing that I feel that is not helping to increase the demand. We are just good with the supply side. Many companies has foreign, they just want to come in with the supply, and probably we need to work on the demand, because I always say that Vidya Balan said 3 things are important in life: entertainment, entertainment, entertainment. So I think for cervical cancer, probably communication is the key to success. Cancer vaccination and screening, I know Government of India must be having a different policy, but I think 60% are work have been done at the institutional level. We should have a clear-cut distinction. What is for the community, what is the institution, because everybody who is visiting the tertiary cancer center, they need evidence-based treatment, training and education, standard treatment guideline, and you can read our Asian Code Against Cancer. I want a uniform messaging that should be in terms of the Indian Code Against Cancer, especially for the HPV vaccine and the screening. And this is, we compare 21 countries, the HPV vaccination program that we published in Lancet, and we could see that what are the differences in different countries, campaigns, so the vision, and probably the last one, I would like to say, probably don't talk in terms of I, because for me, the people who talk in terms of I are the because illness starts from I, and the critical letters of wellness are we. So now you can understand, if you want to and do well to the society, we have to come together. Healthy communities have hope, and those with hope have everything. I think we are very hopeful that we will start some kind of work. We have to initiate work first, and thank you so much, IPVS, for this opportunity, and to talk in front of the audience, Canadian, and at least men matters in every point of time.